call the Health and Human Services meeting to order. We can start with the Pledge of Allegiance. Pledge allegiance to the flag. We should be waiting for Heidi Nightingale, although she's not quite here yet. Present in the room is Brian Muldrow, myself, Elaine Daly, Christina Clarko, and Lydia Patty Ruffini. So tonight on the agenda, we have a presentation let's start with approval of the March 9th minutes from last month. If I could get a motion to approve those minutes.
Move it.
I'll second.
All in favor?
Aye.
Aye.
All right, great. Well, we do also have one appointment to the Office for the Aging Advisory Committee, and that's Michael Chapman from Myers Road in Cato, New York. I'd like to entertain a motion to make Mike a member of the advisory committee.
I'll move it.
Second?
All right, Brian can move it. I'll second.
You're mad now. Leave you second. Second.
Very petty today.
Yeah. All right, great. Mike will be a great addition to the Office for the Aging Advisory. Before we get into our presentation, we do have 22 resolutions tonight. 6 for the Health Department, 7 for Social Services, 5 for Mental Health, 3 for Office for the Aging, and 1 for Youth Bureau. After this presentation, we can get into the agenda and try to go through those resolutions as efficiently as possible. But at this point, I'd like to turn the meeting over to Joe Lynn and the students from BOCES so that they can give us the BOCES student-led youth survey results.
Or should we stand?
You can stand there or.
Yeah, right there's
That's
fine.
fine.
Thank
Yeah.
you.
So I'm Dylan Mahan. I'm the new acting prevention director at Confidential Help for Alcohol and Drugs, CHAD. And this year we have been working with our criminal justice BOCES students, and they can introduce themselves.
Hi, I'm Janessa McLeod.
Hi, I'm Melissa Burke. And the students have worked this year. We got together in November and we created a survey and they sent it out to their peers in grades 11 and 12 at BOCES. So it hit all of the Cayuga Onondaga BOCES school districts that we service in our county. We had a lot of 56 11th graders at 56.12% 11th graders and 43.88% 12th graders who completed the survey. The gender was pretty half, female to male. And then population was mainly white who took the survey. Auburn School District students were the highest population of students who took the survey. This was due to the population of students that are serviced in the county from Auburn. And then as you can see, we also had Jordan Elbridge and Skinny Atlas students who also participated as Cayuga Onondaga services them as well, even though they're Onondaga County. I'm going to let them take over.
So we were actually really surprised to see how many people did not use any substances because we tried to recommend to people, not really recommend, we tried to suggest that things were kept as honest as possible because we made sure that as we went into classrooms to explain our project, that everything was anonymous. And the heavy substance abuse was definitely marijuana, which with the legalization has definitely become a bigger issue amongst high school students versus, anything else. Because for a long time it was alcohol, but now it's kind of shifted as things change.
So in Auburn, we have a plethora of smoke shops and dispensaries, and that's also for other towns and cities. So with that, there's low chance of getting ID'd when you walk into those shops and try to purchase anything. So that's also kind of scary because there's things that some people just shouldn't have due to mental issues. And that's another thing we touched upon on the survey.
From this apart, we also noticed that it was really easy for the kids to access marijuana, whether it was from a dispensary or some vape shop, because we technically don't have dispensaries yet in the county. Vape shops, smoke shops, tobacco, whatever they're classifying themselves as, and also from home from their parents. This is what we saw.
When you see substances, you're speaking specifically of marijuana or
All
not?
substances,
Anything?
anything. Yep. So kids are saying that it's really pretty easy for them to get it. However, still a percentage of them is saying it's easy to get it. So 87% were saying it was very easy, or sorry, 87 students were saying it was easy for them to get. However, 46.78% are still saying out of the 290 six that took that one has two skipped, I believe. That's the question. We're saying that they can easily get it, and the 46 are saying they can't. So. This was an interesting question that the kids came up with was, what do they feel their peers are suffering from? Anxiety, depression, ADD and ADHD, PTSD, or other? Do you guys have anything to add?
Other could be classified as like OCD, or other compulsive disorders that could be like lessened with the effects of marijuana or other substances that are prescribed by doctors, because this wasn't just a survey for marijuana. We touched upon everything. And that's something to really do make clear.
The high percentage of kids, though, that have anxiety was concerning to us, which we know we have seen as an aftermath of the pandemic, as well as other things that the kids are facing in today's society. The depression was really high as well, and anger, we see it in our next question. A lot of our kids are angry. As you can see here, this is why the kids are using. Again, anxiety, trauma, depression, peer pressure, which ironically, as adults, we always think that peer pressure is the #1 reason that kids are using today. And as you can see by the percentage of kids using because of peer pressure, it's very low. But we also don't think kids think peer pressure as peer pressure. Growing up when I was younger, peer pressure was someone constantly, we were taught there was someone saying to you, you need to use, come use this, you know, you don't use this, you're not cool. Nowadays, peer pressure is social media. It's someone posting constantly. Latest trend is all the water bottles, kids with the, you know, they have to have the latest water bottle that costs $55, you know, and that is peer pressure without it being in their face peer pressure, and they're not realizing that. So that was something that on our end that we found a little interesting. Is there anything to add here? Are parents aware of substance use?
This was a really, really big one because if you look at it, there's like, that's a lot. Like, you're not, that's a lot of conversations that aren't being had, like being held in the household with the children. That's another big problem that need to be reached out, not just for children, but for parents as well.
Yeah, it's definitely like, some parents, they're definitely aware of what their children are doing, but they don't always necessarily say anything because there's definitely an issue of parents not wanting to face the fact that, you know, their child is one that uses, because, you know, no parent really wants to know that their kid is doing drugs or going out partying and getting, you know, all screwed up. But it's definitely something that probably should be talked about more, because a lot of people, especially like our age, don't always understand the actual causes that can happen, or the effects that can roll over from using, you know, anything, whether it's, you know, taking too many of, you know, prescribed medication or smoking weed every day.
Or smoking with your parents, because for those that are aware, smoking with your parents could be an option, or the parents could be supplying, and that's another big issue.
These cultural differences.
Could you go back? I'm sorry, I didn't get to meet everybody. I apologize for being late. Jim Basile, District 1. I'd like to see how the 26.87% that parents know, that slide that showed, was it 40-some% of kids are doing it? So like 50% of the parents know. Can we go back a couple slides, Sarah, to wait, no, go back to maybe it was way at the beginning. Anxiety, no.
Why,
Right
is
there.
it easy, how easy it is?
No, I thought there was,
There is a correlation in what you're saying, are your parents aware? And the kids are saying their parents are aware, and then it's easy for them to get, so I wonder if the correlation of what the kids have kind of discussed in their open focus groups is, a lot of them are getting it from home, a lot of it is a cultural thing that their parents are openly using substances. And that's kind of the cultural comparison I think you're seeing in the data that you're seeing in front of you. We did provide this, so if there's a question later that you would like to address, I would more than happily have that conversation with you. Yep. Have you ever taken a prescription drug not prescribed to you? This made me extremely happy. I worked for the Drug Free Coalition for 5 years before this, and we really focused on prescription drugs in this community with the heroin epidemic and the opioid epidemic, with a lot of drug take-back days, prescription removals, informational things. And as we can see from this, our numbers are low. So this is showing that, you know, it made me happy to see the work we put in for those 5 years really played an impact in the students, and that they're not taking medication that's not prescribed to them. So that doesn't go in hand right now with what we're seeing as adults having opioid and prescription use disorders. We're not seeing that right now with the kids, which is a good thing. This one, the kids would really like to touch on because this was our most concerning question.
So this one, we kind of all talked about in our group, like as a whole, and we all agreed that even as a group, there's about 10 of us, that even all of us have ridden in a car at one point or another with someone who's been under the influence, and it's not necessarily always one of our friends. Sometimes it can be a parent, it can be, you know, a relative in general. And it's just something that we don't always think about because, you know, we're supposed to trust our parents. And if we see them have a drink or two, we don't get worried about them being behind the wheel and, you know, being in control of that vehicle if we're in the back seat, front seat, whatever. This was definitely concerning, especially because, you know, like we've talked to the sheriff on several occasions and, you know, he's touched upon, you know, the new issue that's been arising with people driving while under the influence of marijuana has become a bigger issue than even people driving under the influence of alcohol, and how that's been a lot worse and has shown significantly more issues. Like it's like the accidents that have occurred and things like that have been even more severe than people driving under the influence of alcohol.
Ms. Burke, is there any guidance that's provided to our children that if they know a parent is high, you know, what choice does a child have other than getting in the car?
Right, and that's, I think, is the big issue, is that there's not really anything that's taught for what someone, you know, younger can do, because like if you know, you're in the back seat or you're in the front seat, whatever, and you drive somewhere with a parent, you know, it's not always like you could just like, you know, stay there.
Let me
until you
off
know.
here.
Yeah, that's a big issue. And probably addressing the parents themselves first would start to help something. Because if we, you know, show parents that, you know, displaying this behavior for their children can, you know, cause even bigger issues, because, you know, learned behaviors are a real thing. If we show parents that their behaviors can be picked up by their children, and like how many more accidents are happening when people are high or under the influence of anything, then I think that could be a good way to at least start to help the issue. Because like these numbers, like obviously that's not very good. It's almost 50-50 down the center. Yeah, and it's disappointing because especially with how many teen accidents happen a year, whether it's teens with teens in the car, whether it's adults with teens in the car, or even younger kids. Like it's nothing anyone likes to see.
And the conversation also that really touched home for me with the kids was the conversation that this generation of kids coming up right now is battling their parents in active addiction. So a lot of them have been raised in homes that are unstable, have been removed from homes, and their parents are battling. So for them to have that intense conversation like you're talking about is not something that can happen. So we need to come up as a community with what are we going to do to implement to make sure this is not happening before we have something fatal happen in our community. Next. Do you use alcohol or drugs to relax? Again, still higher with the no. However, 107 students did report yes. So
Relaxation sometimes could just look like a stressful day going home, for better lack of language here, just rolling up and letting it to relax. But that's like anxiety. That's more being used as medicine. And with our generation not being in things like counseling or learning good coping mechanisms, they don't know what else to do. So this is what they do. And that's also another huge issue.
and they touched on, well, don't you go, they ask questions sometimes that are intense, and they ask the question, don't you go home after work and have a glass of wine? So again, that learned behavior that we as parents teach. I have 2 little ones, so as parents that we teach our children. Had a stressful day, I need to have a beer, comments like that, that our kids are learning. So we need to work on language with our community. Are you using a loan? Again, 110 students are using a loan. Again, I think this stems from the anxiety, the depression. We're seeing a lot of linkage here as we talk between the mental health piece and the substance use. They need to be treated together. They cannot really be treated alone. And that's where we're struggling, and that's we're working on. I think things like teaching our children coping skills and being resources. The biggest thing the kids always say is they were talking about they can't confine in people at school. They don't feel like they have a safe place to express themselves because they tell one teacher and that teacher tells another teacher. And then the next thing you know, all their teachers are asking them, are you having a rough day? And they're reliving their trauma and situation in every single step of the way, instead of just keeping it confidential between the teacher. And I understand there's rules and protocols, but I think we need to also work on the confidentiality and not talking about students. One of the gentlemen who's in our group said, I can't tell you how many teachers he's told his story as his parents his parent is in active addiction. And he said, how hard it is to go through school and hear teachers telling your story. So that was something we talked about.
No, I don't.
Do you vape tobacco or marijuana? The biggest thing we always hear from everybody is vaping is a huge problem, which it is. The school districts reach out constantly for help for prevention on this and how we can address it. And we're running into hard regulations with marijuana and how we can address things. But we see that kids are vaping both, and still a higher percentage of kids are saying they're not vaping. We've had a lot of older kids ask how can they stop. So on the prevention side, we're past the prevention. Now we're into treatment. We've missed, as a community, we've missed the time period to do prevention. And now it's into treating our youth for addiction. So that's what we're at.
Do we have I can't, maybe because I can't see it that well, I can see numbers, but is there we know how much is tobacco compared to marijuana and the vaping?
No, the students did not, yes, they asked yes tobacco, yes marijuana. So we had 27 students said yes to tobacco, 23 said to marijuana, 60 said to both, and 185 said no.
So 60
students,
said to both.
they're smoking both.
And like a big issue that we see, especially, is that even though, we have detectors in the bathrooms at schools, they're in the locker rooms, places like that. They don't actually do anything to help students fix the problem. They just say, oh, you're suspended, hands off. And, it can be for 2 days, it can be for a week, depending on, what they're caught with, how much of it is, stuff like that. And there's kids I go to school with, they just get caught over and over and over. And they get their bag searched, they get pat down, things like that. But then nothing changes because the resources aren't getting put towards helping the students stop the behavior. It's just getting told, this is bad, you should not be doing this, without any actual help going towards, what's going on with them.
What would your recommendation be for that?
Probably getting a hold of Chad as soon as they see these issues, because, that's a really good resource to put towards, especially for teens, because that's kind of what it's meant for, is to help people, but it's just not being utilized as much as it should. And that's definitely an issue we're seeing, is that it's just kind of getting almost brushed under the rug and ignored, more or less.
One,
penalized legally if it gets to chat, maybe?
Personally, I can say yes. There's a lot of stigma around I'm gonna get in trouble. This is not okay. I know it's not okay. How do I stop? But there's no, I need help. How do I do this? It's strictly for adults. There's no, when you walk into the counseling office, you see brochures for college. You don't see brochures for facilities for someone to get better, mental health treatment, drug treatment. There's nothing there.
Yeah, and I can
Just-
say, sorry to interrupt you, I can say from like the counseling office at Jordan Elbridge, there's one singular purple pamphlet that sits inside the boxes of all like the college pamphlets and the BOCES pamphlets and everything. It's one, and it's directed at opiate use. And like, that's such a thing that like, it doesn't really apply to our generation because the opioid crisis says it's not something that kids our age are going through nearly as much as, you know, like the early 2000s. Like now it's all focused on, you know, people smoking weed, people vaping, it's all that. And it just, the stuff that they do have, which is very minimal, isn't even keeping up with what's going on right now.
So we have to get the schools up to the times, is what you're saying.
when, they're found on school property and they compensate their vape, are they testing? Because I think Pearsall said are they testing it to see what was in it? Or they just compensate?
So I can speak for Auburn because we just met with Jeff recently. Auburn School District does test the vapes or any mechanism to see if it's THC. Jeff approaches it as it's illegal federally, so it's illegal. That's how he's looking at it. A lot of these kids don't realize either with the marijuana stuff, if they get a marijuana charge, they cannot get federal funding for college. So we're also running into that because it's illegal federally. It's not illegal in our state, but you could not get college education funding, like FAFSA stuff, if you receive a charge for marijuana.
So personally, I really like the idea of chat for a lot of reasons. It forces the parent to do something. Nobody, I would say most parents would want their child going to Chad, especially for marijuana. You know, they think of Chad as somebody that's really struggling. So this could, I think that's for the answer, because now you have to go through the classes, you go through the program, and it also solves two problems. It solves them to be able to bring up to the front and also the solution to get them off the pro. So I mean, I know I don't have anything to do with the school district in my position, but I would encourage you guys to get people to do chat.
So I just recently had a meeting to try to create a COSER agreement with the Cayuga Onondaga BOCES schools. What we're trying to implement with Chad in my new role is when a child is suspended or caught or a parent or a teacher is concerned, any disciplinary action, instead of suspending them, they'll keep them in school. And we'll come in and do an intervention program and evaluate them and see if they need to get into services. That's our goal. It has not been implemented yet. We have not signed a COSER yet. There's a long process with that. As you guys know, with policy, that's what we're working towards, because you're absolutely right. That's what needs to be happening. We need to be intervening. And if we're not, we're just failing our next generation. For every dollar we spend in prevention, we have an $18 return to our community. That's a huge thing. The kids we surveyed are 11th and 12th graders. Guess what? The 12th graders are our next generation of adults that are walking through this community with an addiction problem.
I have a unique perspective on this as being a teacher, but I'm curious. So I only kind of see the one side of it, you know, when I report something or whatever. So when you guys, if somebody gets reported and you're brought in, there's nobody ever offers assistance.
No. It's, you get a conversation about what you're doing, how you're doing it, and how it could be fixed, but there's no, here's the resources for it to be fixed. Like, personally, my experience with Testa, you know.
Yep.
So, he is more of him and Lamana, they have those conversations, but I don't, speaking from like her experience, I can't say that her school has
Okay.
those conversations. And I can't say for BOCES that they have those conversations. But in Auburn, it's a little bit better, but not amazing.
Okay. Well, because I will personally like have conversations with people in the building and just ask like, yes, okay, I understand that you know, the rules are in place and they're gonna be enforced, but let's make sure we're offering some, you know, a way out of it if you want it.
In the district's position on the illegality of it, because it's children are under 18, and obviously it's not legal to smoke marijuana under the age of 21. So his sense is it's not legal. So what does that really mean? That
It means like the charge will be a little bit, he takes it more seriously because,
he's not bringing police in, he's just.
so the police, it depends on what they have. I mean, if they're selling at school, it's gonna be obviously a police officer
Yeah.
coming in.
But because it's
really-
illegal, he's treating it.
And he wants to let the students know he's serious about it. He doesn't want it in his school. It affects academic performance.
Yeah.
You know, we see failure, their brain's not developed. If they're smoking synthetics, we're seeing psychosis breaks. I mean, there's a lot that comes with marijuana. And the big thing that we hear from kids is it's organic. It grows in the earth. That's not how marijuana is really being made. Well, it starts that way, but it's being processed with chemicals. It's being broken down.
It's good for you.
Yeah.
So is tobacco, we know
Yeah.
that.
That's like all the commercials that we see on TV now that list like, 15 chemicals that are, in tobacco, whether it's, liquid, whether it's. And the flavors, those are.
They're
even
like
chemical.
marketed towards us,
Yes.
like cotton candy, grapes.
Yes.
They try to make it seem sweet and like it tastes good, and then it's like a good thing by added like just slapping those sweet flavors onto it. And like, obviously, like that's not good because that can entice even younger kids, just like, oh, this will probably taste good. Let me try that.
Cayuga County had 2 10-year-olds overdose last year on gummies, THC gummies.
I think my biggest concern is that, if somebody wants treatment as an adult, there's a lot of help, right?
There's a lot of help for kids, but we don't.
But what I'm
receive
saying,
that.
what I'm saying is kids don't have the maturity to ask for help in the proper format and know what resources are out there. And we're catching a high percentage of kids with vape, with marijuana, and admittedly that at least like 60%, 20, if Jim did the math on that real quick, 50% of parents even know it. So if we know there's a problem, this presentation is beautiful, but do you have an answer other than, because I think the answer is to encourage Chad to get involved with the school districts. It's not a popular thing. I don't believe in taking somebody's financial aid away and their future away for these type of drugs. But I do believe that an intervention of some type of counseling will allow the parents to address the situation. Because we can't parent them, but we can also make sure that it's getting talked about at home.
Absolutely. I think it's the conversation at home. It's the conversation in the community, the marketing in the community, not allowing for vape shops to pop up on every corner, not allowing for, marketing of flavors, not allowing, there's a lot that is policy that can be done on that end, but absolutely we need to be there. Kids also need to realize, like, we've been really pushing the message, like, we don't have to tell their parents that they're coming for services. So they can sign through a school for a referral and we can see them without a parental consent through the school district. So that is something that we have been working on and really pushing and trying to get kids to realize the services are not just for adults, but there's also the stigma that walks with it. Parents don't want to drop their kids off to Chad to walk in through the doors at Chad.
I think they should benefit in this situation.
That's the problem.
I think dropping the stigma helps you in this case.
Mhm.
I mean, nobody wants to be called a bad parent, right? So if you're smoking weed with your parent, but if you're dropping them off, I think the stigma actually helps you. I think the stigma is the stick that, you just got the carrot and the stick. I think the stigma is the stick in this situation with children.
Yeah. And the marketing, I mean, we put an ad out. Have you had the conversation with your teen about substance use and to reach out to us with a hotline number if they needed to talk about it? And ironically, the campaign people put underneath me, come to Union Springs and where you can get your smoke, right underneath my messaging. So luckily I had to have a conversation and call the gentleman. And I said, I get that this is a business for you, but can you look at the messaging before you place an ad underneath one about getting kids help or anybody help, whether it was an adult going for help, the ad still wouldn't have been appropriate. So I think it's important to, do things like that. As a community, we can work on things like beer gardens, almost like the generation is gonna become like smoke gardens, like areas where people can at events be outside and smoking. Because the last thing I want to do, I hate walking around and explaining to my 6-year-old that the smell of a skunk is marijuana. He's probably way more educated than any 6-year-old on substances because of the work I do. But that's how the conversation started. He thought a guy's car at Walmart was on fire because the guy was hotboxing in it, so it was full of smoke. And then he thought that someone ran over a bunch of skunks. So we had to have a conversation around substances. And I think even the conversation now with our kids is about not even taking things from people that their friends even candy because it could be edibles without even realizing it. So our community is up against a lot.
Because like the edibles look really similar to the actual foods themselves, and that's like,
Other packaged to look.
right,
Gummy
just like
bears,
Wonka
cookies,
bars and Skittles.
everything.
Oreos.
And then the psychedelic bars as well. Those are
They
candy bars.
Yeah, they look
I
really
feel like there
similar.
needs to be some good messaging out to parents that do use those things, that they need to make sure that they're locked away and
Yeah.
secure and not
Yeah,
accessible,
conversation about
especially to the littles, like those 10-year-olds.
We're working on that. We're working on trying to get messaging out. Kind of like our campaign around lock up your meds. We're gonna kind of do a lock up your marijuana campaign, which sounds crazy to say, but it's a harm reduction model in a sense. But that's what we're up against in our community, and it's the, point of view of where we're at. So we don't take up much more of your time. I'll answer
Sorry,
your
I was
question, we'll
just
move on.
wondering, are you gonna be giving us contact information to reach out to you all so
Yep.
that?
So the girls they have brochures, and then I'm always available at Chad Monday through Friday. If you can always get a hold of me, my email, Elaine has my email. I'm always willing to answer any question. Please feel free, if you see me in the community to ask questions, I will always answer.
If you have some kind of flyer I can display in my window at school
Absolutely.
for services, I would be more than happy to put that up in my. classroom.
Absolutely.
Thank you, Joanne, but I really want to thank these two young ladies that,
Awesome.
this is good work you guys are doing. And I can tell by your demeanor and the way you present yourselves that you guys are going to be leaders in the community. You're already leaders. I want to tell you as legislators, we sit here and we hear a lot of presentations. You guys did an awesome job, so I want to give you a round of applause for that.
And to go along with the surveys that we gave out, we did make sure every student got a copy of, a resource page, like listing information for all of these, like help services, so that if they did, feel some impact, get some help, that they did have that option. They actually did have the contact information, and were able to get into some program.
I got some final questions.
Go ahead.
Will you be doing a survey every year so we know where we're comparing?
So this is actually not a accredited survey. This survey, the students put together. This
But
is,
can we do this every year?
we could do a survey
So we
like
know
this.
how we compare to in the future?
Yeah, so previously we tried to do a survey in all of our school districts called the Pride Community Survey, which is surveys students grades 6 through 12, and you're supposed to conduct it every 2 years so you can track your prevention efforts and what's happening and decreasing and increasing and things like that. We had a little bit of pushback from the school districts on doing the survey
Really?
because it's about a 45-minute survey and teachers don't want to give up their academic day. However, it is a nationally recognized survey. It does get conducted across the nation. A lot of people do it. You can get a lot more out of it than just substance use. Anyone from domestic violence in our community to mental health, homelessness, reading literacy can get information from that survey. So it's extremely important. We have been getting a lot more buy-in from the schools and a lot more engagement from the schools since the pandemic has happened. So we're hoping that we can build that relationship with them and move forward with implementing that survey so we can start doing something like this every 2 years. However, Ms. Jones, who is the criminal justice teacher at BOCES, and I plan to do this again next year with the students.
Great.
We want to continue this on.
Now, will you presenting this at the different schools, what you just presented to us?
We haven't gotten that far. They don't have that much left of school. So if they don't mind me going on and taking it, I don't mind
I
doing
think
that.
that's very important.
But
We do plan on giving it to other congregations at the BOCES building
Okay,
later on in the month.
I got one more question. Deb is our new youth director in the county, and she's got a new youth board. Is this something, Deb, that your board can maybe help
Absolutely, and I know that the Youth Bureau works with Chad and Jolene and Caroline just put in a request for funding as well, so we'll be working. A lot of the
Outstanding.
the marketing that she's talking about is close to what they've been asking for the funding as well.
And that's why we have a new youth board to help in things like this. So thank you. Thanks.
These are great. You know, these are only two of the students we worked with in our focus group, but the kids this year were phenomenal. Like I said, they created every question. There's actually 20 questions. We can leave this because I know you guys have a lot of things to go through, but one of the other ones we did see was the overdoses. Kids did report on overdoses that they had seen. There was a high percentage of youth in our community. I don't know if you want to click through to that one quickly. About the kids, we already, a lot of family, we already addressed all this stuff in our conversation, but the kids did witness, a lot of kids, 61 kids had witnessed an overdose in Cayuga County, which is really concerning. And then the next question we asked was, would they be interested in a Narcan training? And 113 of them said they would be interested in Narcan training. So
What was disappointing was how many people said no, though. And we kind of tried to reduce it down to maybe people not understanding what Narcan 100% was. Because like we went through the training last year because, you know, it was part of our class. We all signed up to do it. And it was definitely something that's very helpful for us.
Very useful.
Very, especially since like you never know when you're going to see someone down because, you know, they're taking things. And it's not always necessarily, you know, like junkies. Like even like elderly people, if they take too many of their medication, if they forget something, things like that, like they happen. And we agreed that we don't think that everyone understands that it's not just, you know, the person, you know, sitting at the corner, you know, living under a tent that necessarily would need something like this done to them.
we're working on language with the students and working on things like Narcan can also be handy even for marijuana because nowadays things are laced with everything. So they have to take the chance that before it used to be you were just smoking marijuana and you were okay.
Organic marijuana.
Organic. And mushrooms are organic. Yeah, that's our next one we're concerned about. But they you know, just trying to tell them that Narcan is not just for opioids. It's to have on your hand in case, and we're trying to push it as it's a life-saving tool to have on them. So we want to thank you for your time.
One thing I'd like to close with, and this is our state legislature that passed this law. And shame on them for doing this in our state. That's caused so many kids and so many adults, so many problems. And we haven't seen anything yet. Wait till the stores, legal stores start opening up. There's going to be one on every block. And it's going to be unbelievable. They never did any research. The states out west have done this. There's been more fatal accidents for driving from marijuana than alcohol. And the only reason our state legislature did this is for money.
Absolutely.
Absolutely. They never asked one police officer. I'm sure they never asked organizations like Chad. They never cared. All they wanted was the money for the state, and shame on them.
And then, you know, the kids were talking about there's nothing really for them to do in our community and that, you know, we were trying to come up with ideas of things they wanted and stuff like that. So I think that really bringing in kids for you guys to talk to about what they want in the community is key too. Because that's the other thing, the more involved we keep kids in our community, the less likely they are to get in trouble. So that's really where we're at, and thank you for your time and thank you.
Great job.
For your
Thank you very
time.
Convince them to do the surveys in school. Don't ask a specific group of teachers to give it, like don't ask the English teachers to give up a bell. Ask the building principal to run on an hour delay schedule so they stay in an extended homeroom, complete the survey, and then go off to their day.
This was just conducted in one school. This was just BOCES. So if we conducted this in every,
Absolutely.
they would be
Yeah,
actually, it's crazy.
but that might be a way around the teachers not wanting to give
The
up
big
their
survey,
day.
the big survey, yeah.
Yeah.
Absolutely. Thank you again, everybody.
Thank
Have a
you
wonderful
very
day.
much. Thank you again.
Yeah.
Thanks. Thank you so much. Good.
Thank you.
Thank you.
We do have quite a few resolutions on the agenda tonight, so I'm going to look to group a number of them together, get a motion and second, and then be able to open it up to questions or discussion. Not in a way to shut down conversation, but maybe to kind of get through what we have tonight. So Kathleen, if you would come up, and we'll start with the 6 health department resolutions. HH1 is authorizing to create and fill the Director of Health Education and Public Information and vacate a supervising public health administrator position. We had a lengthy conversation about that last month. It was also discussed at Ways and Means. Information was given out about, moving from a supervising public health administrator grade 33, which is a step 1 of 67 to step 4 of 74. That's in the collective bargaining agreement, eligible for overtime, and replacing it with a Director of Health Education and Public Information, which is a non-bargaining grade 5, with a similar salary range of 67 to 77,000. You also have HH2, which is allowing you to create and fill a WIC competent professional authority or a WIC nutritionist. And when I looked at that resolution, what you're asking to do is use either of those titles to replace an open, unfilled senior nutrition position to give you some more flexibility, all being covered by the WIC grant. So if we, that position is vacant now, so whatever you can recruit, either a CPA or a nutritionist, that's what you're going to do. HH3 is allowing you to fill the deputy director position, which we've talked about is being funded through the infrastructure grant, the public health infrastructure grant that you're going to be getting for the next 5 years. You had a plan in there to look at leaving a RN vacant once you promote someone to a supervising position, all part of that proposal that we talked about in detail last month. The other is to enter a contract with Finger Lakes SPCA so that the department can fund 3 animal rabies clinics at a cost not to exceed $5,100. And that will be in effect for 5 years unless they change the rate, and you'll bring it forward again. 5 would be to allow the department to finally accept the 5-year WIC award, which is been going through 1-year extensions, $591,000 a year for the next 5 years to support the WIC program. And last, you have a contract with NICEHO to give the department $2,840 so that you can do outreach and education on harmful algal blooms. So if I could get a motion for HH 1, 2, 3, 4, 5, and 6, and then a second, we can then open it up to questions.
I'd like to carve out HH1, please.
Okay. So how about a motion for 8,
2 to 6?
2 to 6?
Second.
All in favor?
Aye.
Okay, if you want, we'll go over again HH1, which is the filling of the Director of Health Education and Public Information and the vacating of the Supervising Public Health Administrator. Motion and a second
I'll move it.
for discussion. Second, okay, and yep, we'll open it up for discussion.
Just again, talking about concerns, and I hate to do this to you because I know how important this work is. But it's happening here because it's going to be happening in our budget process as we go forward. We need to start looking at our organizations. So I'm sorry, I'm starting with you. We have a lot of heads and it seems to be little scrutiny of, again, not focused on you specifically, in general, not enough scrutinizing of our organizational management. So I just wanted to separate it for that purpose. I think that it's important that we are managing our taxpayers' dollars properly. I know you understand that. Thank you.
Okay, are you going to support the resolution? I mean, are we going to get a motion to?
I think, do we vote 6 right now? Or do
We do have a motion. We did
we do have a motion?
for 1, and we passed 2 to 6, I thought.
You did.
Yeah.
So this is for, we have a motion and a second for HH1. So I guess we can have further discussion or we can vote on passing it. All in favor of HH1?
Aye.
Aye. Opposed?
Nay, I oppose.
Thanks. I'll be real brief. There's a lot going on. This past week, I know all of you received a little bit of information I sent around about National Public Health Week. It was great to see what our educators and fellows could put together that is of no cost, but could really take an opportunity to showcase some of the programs that we offer within the health department. And that's something I hope we can do more and more of so that people understand the wide breadth of services that the public health department provides to our community. I sent also the link to the Spectrum news channel interview, which if you haven't seen it, it's well worth a view because our interim director, Lori Fisher, is going to be retiring at the end of the month. Our children and youth with special health care needs director, Megan Sidoris, is working in an interim capacity right now in that role. And she was interviewed about working with children with autism. And it was really wonderful. I thought a really sensitive way to convey the work that we do as an agency, but also certainly the family that was interviewed was just stellar. They did a great job, I think. We continue to look to fill our vacancies. Working with Civil Service Office to make a few adjustments to a few of the job titles. And also we're trying to get the word out in every venue that we can and that we know of to seek potential candidates. We've had some discussion, and I might be repeating myself from last month, but we've had some discussion with Sharina Drosco and Diane Ferris and some other members about ways we can get the word out. It's college graduation time. We ideally would have started a semester ago, but getting the word out through websites. The Handshake is a website that's used by a lot of the colleges to let them know about the job opportunities, to specialized programs to let them know. So for example, Ani Fish, who is an engineer with our department, she actually is out on a temporary leave, but she was asked to speak at her alumni school, ESF, Environmental School of Science and Forestry. So she'll be going there in a couple of weeks. And she's going to talk about the public health engineer position that's open. And that's something I think that's important. Sarah, friends who are engineers, get them, that we need this age group who's fresh out. You don't need a lot of experience for this particular role. You need to have the degree, and it can be any engineering degree. And then we can teach you, right, how to do the job. So that's, we do have an interview set up next week for an engineer. We had a junior accountant interview. The person needed to reschedule, so hopefully we'll get them back on the docket for next week. But the nutritionist positions, WIC coordinator position, the director of community health services, they're still hanging out there, and we don't have any applicants. Well, that's not true. WIC coordinator we do, and after I work with civil service, a couple of those entities will likely be eligible, and so we can start the interviews with them. Anything we can do to shake the bushes is welcome. Preschool, a lot of things happening there. The transportation bid did go out for preschool transportation. Questions we're doing this week, so I'll be coming back in May with the analysis and to request that the legislature approve the award. We are working with the McGinnis software system to open the committee, the preschool special education portal. And that should be a more efficient manner for providers to input some of their data, less paper for us. It should eventually streamline once everyone knows how to use it. And the good part is that a number of our counties around us have already started implementing this a year or two ago. So it won't be new to some of the larger agencies, right? It will be new to some of the individual therapists. We're working on renewing the contracts, if I have a cycle of contracts. And community health services, we're working with the school districts to get out our back to school immunization. We'll have a few special clinics in the summertime, but we try to get the word out through the schools prior to the end of the school year. And we will be holding our last public COVID clinic that is no charge on April 21st. We'll be seeing a press release about that. Really, the stall had been because we're having difficulty with the registration, the state registration site. So it may be paper only. There may not be any registration. The specifics will go out because we want to give people time to plan for this, give them at least a week, or just about a week in this case. And then we will stop providing points of distribution at the Finger Lakes Mall. We have surveyed pharmacies and to see what they are providing as far as COVID vaccination. We know that there are some healthcare providers that are providing some COVID vaccination. So it is our opinion and in working as a group and with our medical director that
There's enough.
as it's available in the community, that we will be needing to do it. And our medical director is appropriately reluctant to bring in emergency use authorization vaccination outside of the pod scenario, right? So to bring it into our regular clinic, if we do that, it's going to be based on need and demand, and it will be approved. It won't be the emergency use, because when we do that with the pod, it's very intensive screening, although with all vaccines, there's intensive screening, but it's also having emergency responders on hand and having the physician on hand in order to answer questions, which is what we've been doing in all of our clinics since they were implemented a few years ago.
Certain vaccines started as emergency use, but then got fully approved, but there's still some that are
There's
emergency
still some
use,
that are
which
emergency
is-
use. I wouldn't even hazard a guess because it might be a particular age group versus a brand.
Gotcha,
So,
gotcha, okay. Because
but
I
I
knew
can
it
find that out
started
for you.
that way and then got it fully approved, but there's still some you're dealing with and he doesn't want that liability.
Right, for the EUA, but also again, if it's available elsewhere,
Yep.
we're supposed to be the safety net.
For sure. That'd be some relief.
Ask me a month from now.
Yes, yes, yes.
Yes, it is. You know, we're certainly all feeling the changes that are coming forward as the community transmission levels become less and less so. I think we're all going to see that as far as mask use in clinical settings, like the hospitals, nursing homes, our own Article 28 clinic. We'll be able to make some changes there shortly, as long as the community transmission level stays within a certain range or below.
Any questions for Kathleen? Dave?
Just one thing, I will have a proclamation for Public Health Light Week and the 25th. We want to recognize Christine's, Lauren's, and Brenda's staff too. So that'll be given on the 25th.
Sounds good.
Congratulations.
Thank you.
Thank you.
Thank you.
Thanks.
Okay, if we want to move on to social services, and after looking over the agenda, I'm going to leave HH7 and HH8 for individual discussion, but maybe we could group together HH9, which is authorizing the Commissioner of Social Services to fill a senior caseworker position in the department. That's a funded vacancy, I assume. Yep,
Funded vacancy.
Authorize the Commissioner HH10 to fill a social services attorney position in the department. I understand you had a recent resignation of one of the attorneys in the department. HH11 is authorizing the chairman and the Commissioner of Social Services to renew the contract with Rescue Mission for homeless family and transitional housing. It's a contract renewal. It's a $103,000 contract that you've had for a number of years with Rescue Mission.
Yes.
You want to continue that contract. HH20 is to authorize the Commissioner to fill a caseworker vacancy. I was approached by Jed Marshall just before, right after the agenda came out, that you just had a recent adult protective worker that has resigned and I'd like to get that filled. And then HH22, we can talk about also, but that is the contract with Cayuga Community Health Network. It would be the $60,000 funding from the ARPA funds to deal with the homeless outreach and advocacy program where Sherry Weiss came and her, and the individual who actually does the program came to the last legislative meeting to talk about their work on trying to get people into stable and housing and out of hotels and homelessness. So can I get a motion for
About 8 and 22, please.
8? Yes, 8 I didn't do. Okay, yeah, 7 and 8, I knew we had to have further
9 to
discussion.
22, yeah.
And.
I'll
yeah,
motion
Thank
9,
you,
10, 11, and 20.
Great. Second. Okay, 9, 10, 11, and 20. Can I get a motion for a second? All in favor?
Aye.
Aye.
Okay, great. All right, then we'll go on to 7, 8, and then we'll talk about 22.
Okay. So HH7 is asking for the ability to create and fill 2 principal account clerk 2 positions in the department, and to abolish an assistant payroll system specialist and a resource assistant position. So this really is about us trying to get creative. We have had a very hard time with recruiting from outside of the county Department of Social Services positions where folks have financial fiscal background and training. We have had a very hard time getting any applicants for positions that we've had. So I worked very closely with Jen. Jen was really instrumental in kind of brainstorming and meeting with staff in the accounting division to think about a way that we could have our needs met, get our work done, and utilize the staff that we currently have to get the work done. So this really is about creating 2, it's a totally new position that we don't have. These principal account clerk 2 positions, they're new, and they are they're a way for us to hopefully retain and promote staff in DSS that have experience that they've already gained when working here, that we'll be able to utilize to get the work done. And these are folks that don't necessarily have that formal background and training in accounting, but they've shown us in their work, and in some cases, they've actually taken on this work that's already been done in the past by people that do have the financial background. So it is a grade 16. It's a position that really falls in between our junior accountant, which is a 19 higher level position, and then the principal account clerk, which is a 14. So this is a grade 16 position. The other thing that I want to say about it is, hopefully this will help us be more successful and just being able to get the work done. And, we can offer the test for this assistant payroll systems, or for the principal account clerk 2, and promote the staff from within into these positions.
A motion and second for discussion. Good, want to do a
I'll move
motion and then second it, and then we'll open it up for discussion.
Oh, okay, yeah.
I'll second. Okay, great.
So I noticed that, they're both grade 16.
Yeah.
What you're abolishing and what you're proposing to bring on. And from what I understand from the discussion, so there's internal candidates, a way to promote. Is the principal account clerk 2 job description, does it give you what you need should these 2 people not return to work?
Yes.
Finish out next year. There's not such a change.
Yeah, and John, I don't know, John's not. John, can you hear us? I don't know if John can talk to us about that.
She's muted.
For a point of clarification, I asked a bunch of questions of Jennifer when this first came out, and if I'm not mistaken, the payroll assistant specialist, we just created. And she was quite honest with me that they did not have anyone fight for that job at all. So it's never been filled. That was the grade 16.
Yeah.
And then I think the resource associate, or whatever it's called, is the grade 14, but it's step 4. So I asked her, where did this position come from? They're totally brand new with in the job specs of some of the duties that I think the department needs to get some of the work done. So instead of trying to get people from without to take these jobs, this was an opportunity to see if they can promote from within current people who live here or work here and give them some additional duties to try to get the work done. I asked her specifically, I said, well, then aren't you worried? Because she said no one wants to take a contingent permanent, a temporary job that's not permanent to them. But the fill behinds will be just that.
But entry level.
Entry
We have
level.
an easier time with our entry level staff taking those positions
Right.
than we do the promotional.
Right, and she said that the staff that would be eligible for the promotional would have two opportunities to actually take the
Yep.
test. So I think, they tried to put their heads together from what I could see and come up with something to get the workforce that they need. But, one is a grade 16, one is a grade 14 at step 4. But they are clearly going to abolish the payroll specialist they've never been able to fill, and they're gonna abolish one of the resource associates, if they have these two candidates take these promotions.
And it would be budget neutral.
This year.
Yeah, I don't have any concerns, beyond that question that, looking toward the future, these promotions, because, this new, not only title, but the description that comes with it suits the department well, regardless of, who's able to take it today or do the work 5 or 10
Jen's
years.
unmuted now. Jen, are you there?
Yeah, sorry.
Oh, I forgot you were ill. The question is the new job spec for the account clerk or principal account clerk 2 is really an upgraded job spec that gives the duties that you need for the department's work.
Yes, it does. But the piece that actually is the most important is it's the people who have worked in DSS accounting for several years, but don't necessarily have a 4-year degree in accounting or even a 2-year degree in accounting that some of the other positions require. But this one takes into account the experience that they've gained from actually working in the department, doing the accounting functions. Can you hear me?
I'm good, I'm clear. My question's answered.
Thank you. So there's no increase to headcount,
No increase,
and you said a net to budget this year, but
neutral, yep.
sorry.
This year.
What about going forward?
So we didn't, John, did you map it out going forward?
So no, it's actually a savings for this year because it's the difference of bringing people in a step 1. So it won't actually be more until 2 years from now, but it's minimal. I didn't actually map it out.
It's the difference in salary between the 14 and the 16 minus the reimbursement.
Yes.
Yeah. Okay, but it would be going forward. Instead of having 114 and 116, if this plan works, you'll have 2 staff that are now grade 16.
Yes.
Instead of 16, 114.
And in 2 years, the increase is probably less than $1,500 difference. I mean, it's really not very much.
Overall budget, though, we don't have the grade 19 junior accountant anymore. So that's also, it more than makes up the difference between a 14 and a 16 going forward.
Yep, I'm sorry.
Thank you. The previous requirement was either a 4-year or 2-year degree as part of it.
Yeah.
So were those people also getting some kind of continual education to stay up with things?
The folks that had.
Previously in it, to stay up with the accounting for that, or was it just a learned specific to
The folks that came in with a financial background or the degree, were they getting continual education?
Like I always hear about how things are changing constantly. I guess what I'm getting at too is if it did, are we gonna make sure that these people stay up with?
I don't think.
One thing to stay up with experience because you're working with people that are doing it and staying up with the changes. So to make sure if we move someone into this position, that we're affording them the opportunity to make sure that they're staying up current with.
I'm not aware that they had actually requirements for continual education.
It was just a matter of having
the degree.
Okay. I don't know if that made sense. I see a lot of.
But I
No, it makes sense.
know what you're saying.
It makes
Right.
Okay, yeah, we just, because everything's always changing, not just your department, a lot of them.
I think they're more data entry, right? They're not making.
Well, I mean, there's one of the duties that if we get permission to do this, that it's payroll. There's a lot of work with payroll for the Department of Social Services employees and then the claim. So working on the claim, making sure that we maximize our reimbursement. So those are things that people can learn. They don't necessarily have to have an accounting degree, or a 2-year degree in accounting. So we're hoping that this is a strategy that's going to kind of keep up with where we are with being able to recruit and bring people on board and, get the work done. I mean, we're scrambling right now to just, within what we have to get the work done.
Right, so DSS accounting and that reimbursement piece, the 62%, et cetera, is very specific to New York State and DSS accounting. So these folks have been at it, and I'm sure New York State provides ongoing training. It always did before, training when things move around within this kind of work.
Yeah, it is definitely a specialized niche, and it's not something that people come in knowing. I think that there's a lot of networking. There's a lot of, collaboration between counties and trainings that you go to, different state trainings to help you develop that knowledge and, keep up on what's changing all of the time. So yeah, it's definitely is very specialized in a niche that's, people don't walk in the door with that.
Right. Degree or not. Yeah.
I think the question you had, Lydia, the head count will be the same.
Yep.
This is, hopefully this strategy does work to get
This is our,
people in to do the work.
Yep.
We have a motion and a second. Can we take a vote? All in favor for HH7?
Aye.
Any opposed? Great. Okay, now your other one that you need a new gray matter to go over, but authorizing you to create 6 budgeted human services examiners, and that's in that help category, which is that dispensation you got from the state to allow you to bring people in for a year period without an exam. And so you need to create those non-competitive positions so that you can accomplish this.
yes.
So if you want to my initial, maybe we can get a motion in a second and then we can talk about it. Can I get a motion for HH8?
HH8.
Create the
I'll
6.
second it.
Okay, great. My initial conversation when I looked at this is you're creating 6 budgeted human services examiners under this help category. I asked Jen, well, okay, then if you're creating these 6 positions, why can't you eliminate the 6 that the other 6?
Yep.
And I think the conversation went, you'll use the funding of those particular 6 examiner positions to accomplish filling these 6. But when these individuals finish their 1 year and you're retaining them, they can't stay in this non-competitive title. They have to move back to this, to the competitive title that you have in your budget right now. So, I mean, that is clearly what the requirement is if you're going to get this dispensation for this title. Is that how it will work?
Right. And Jen again was like, she was instrumental in packaging up, putting this together and worked with us, closely to go and present the information to our, Cayuga County Civil Service Commission. And they agreed that this was something that we should pursue. And they submitted the information that they needed to the state. And I believe that they, that information was just submitted. And once it gets approved by the state, we'll have that 1 year time frame that whenever there's a human services examiner position that becomes vacant here, we can fill it with this help type of, process where the person will not have to take a civil service test in order to be, put in the position. They can be, it can be non-competitive
For that year period.
Yep. And then after the year period that they're here, they'll be in, into this back into the other position control.
That would be competitive and permanent, and they'll just do it without taking the test.
Yep. Jen, do I have that right?
That's correct. Yes.
So I would just like to make sure I understand. So we're just trying to create a pathway for people to get into these jobs without having to take the civil service exam. Okay.
This is no increase to head, sorry.
Go ahead.
So this is no increase to head count, no increase to budget.
No increase to budget, no
No one
increase to
really asked for things like that.
I think one of the things that I want to let you know too is that whenever we have a human services examiner position, I will have to come back and do this again and come in and ask for this creation of this help position unless you folks feel like you want to give me permission to
Any subsequent.
Otherwise, I have to come back every month that we have a human services examiner position and ask for a creation of a, position control, help, position with the help human services examiner. So I don't know, how you feel about that. You can certainly come in.
You have 6
right now.
vacancies right now.
Yes.
And that's
we
why
already
they're
have permission
creating
to
6.
fill.
If someone quits tomorrow, you'll come back and have to. Go
So
ahead.
what you're asking is, if there's no changes to these 6 positions, you don't have to come back. That's what you're proposing.
Well, I would have to do a resolution specific to the help, to creating the help position, the human services examiner
I
help
think
position.
that if there's no change to budget, why should you come back? I don't
Well,
know.
I'll still have to come in and ask for the human services examiner bill, because that's our process. But I wouldn't have to do a
I'm
separate
confused.
resolution.
I'm confused. That's
Oh,
6
yeah, you
spots.
still have to ask for the fill.
Yeah.
Yeah.
So no matter what, you gotta come back.
Yeah, so maybe we can package it up together,
Right.
7-in-1 resolution, but
Okay.
we already had permission to fill 6
Right.
human services examiners, and that's why I needed to come in with this one resolution to create
Got it.
the help,
Because HR or civil service wouldn't create these special titles.
unless I have
Yes.
permission.
So
Okay.
I'm with Brian. I'm a little confused now too. If she's getting permission for 6 and as long as she doesn't surpass 6,
Good.
are you gonna have to come back?
If you approve this resolution, I will have permission to have this 6 human services examiner positions that you already agreed to allow me to fill
If they quit,
as,
come back.
well,
No, I guess the thing is if tomorrow someone quits,
one of these.
an examiner
Examiner
quits. Yeah, you're gonna have to come back anyway. Right now, you have permission to fill these 6 vacancies in this fashion if we
Yep.
pass this.
It's aligned with how other departments work.
Yep, exactly.
All right, let's vote. Everything's looking ready now.
All in favor?
Aye.
Any opposed? Great. Now,
22.
you wouldn't mind introducing HH 22. Which is to allow the department to contract with, and there's an updated resolution here because the original resolution that was passed out didn't have the lines where the money would come, because if this passes, 60,000 would have to come into of ARPA funds would come into your budget to be able to pay for this contract. But this is, if this passes, this would be a recommendation by the committee to support using $60,000 of ARPA funds, awarding it to Cayuga Community Health Network, who does the homeless outreach and advocacy program, and give them 60,000 of ARPA, which, based on the way the resolution's written, they're going to use 30,000 of county money, 30,000 of City of Auburn money, and keep the program going for the next 2 years. So if we could get a motion for HH 22 in a second, and then we'll open it up for discussion.
I'll move it.
Yeah, second.
Okay?
Yeah, sorry. So you have a committee, right, of ARPA funds?
Yep.
The ARPA funds distribution, and
3 of the 4 members here.
and 3 of the 4 members are here, so this is perfect. What say you?
I believe we supported it, when they came in and did the presentation for
pres-
us. It was, yeah, it was really well put together, and it really illustrated how if we can put these services in place now, there's gonna be a large cost savings on the back end, because we're not gonna have to house people in hotels and things like that. So it's much to really kind of help with that particular situation.
We had discussions before the presentation.
Yes. Even before.
Asked the presentation to be made, which was, I can't remember.
Just last month.
Right.
Not that long
It
ago.
wasn't, yeah, and we also asked to get some data back on they had some data that proposed on what the cost savings could be with things they've already done in the presentation. And we've also asked them to come back and keep track of that to show if we've made those goals or, based on what they presented from that. And it was 50. We're doing 30.
Total of 60, 30.
So 30
years
for
each
each year,
Yeah,
and the
so
city's gonna
It's gonna
do
do
30 for
30
each
for each
year.
year. So we're splitting it with the city too. The
Nice.
majority of it's here. So
Right.
we were in full support of it.
Yes.
Thank you. I have no other questions.
All right. Okay, we had a motion and a second. All in favor of HH 22?
Aye.
Great. Okay, now we're gonna go, do you have anything you want to talk to us about?
Not really. Well,
That's enough, right?
Any
Gotta run
questions?
off, 'cause they changed the.
Yeah.
Should get going.
Thank you.
Great.
Thanks.
All right.
Thanks, Chris.
Okay, I'm gonna kind of talk about grouping together 12, 13, 14, 15, and 21. And
Can we separate out 12 and 13?
we certainly can. Okay. Okay, HH 12 is amending the 2023 budget, mental health budget, to make some adjustments in the 100% state aid and giving additional funds to Unity House and Cayuga Counseling. Can I get a motion in a second, and then we'll open it up for discussion?
I'll move it.
Right, yeah, second.
Okay? You want to ask a question about?
Yeah, to understand it a little bit more, so
Yeah.
we're amending the budget. What does that mean as far as a change, please?
So this is additional state aid money that came through for specific programs. For Cayuga Counseling, it's for the satellite clinics they have in all the school districts. So there's a specific amount of money for each satellite clinic that they had. And then for Unity House, it was for supportive housing, so it was additional funding coming through the state, and it's 100% state aid. So we're just amending the budget to reflect the additional state aid.
The money we're bringing in.
Yeah.
Thank you. I have no more questions.
Okay. Motion, we had a motion second, all in favor?
Aye.
Okay, great. HH 13, you wanna create and fill a full-time staff social worker at the mental health center. Let's get a motion in a second, because there'll probably be questions about that,
I'll move it.
Right, yeah, second.
okay? I had asked, I had talked to Lauren about the resolution and actually trying to understand what you were trying to get at in terms of clarity. And you are looking to add an additional staff social worker to the operation because you have a book of business that's pretty large and you have people waiting for mental health services. When I did question about how do you have enough money in your salary line to actually support the salary and for this full-time worker that you didn't have budgeted in your 2023 budget. And that's where I think the resolution got a little clearer. You have two full-time, or you have two part-time social workers in your part-time line of your budget that you have not been able to fill. So the ask would be to move that money from the part-time line to your full-time line for the period of time, probably 8 months or whatever we have left of the year, and move that money so that you can hire and afford in your point one a full-time therapist. But so you're moving that money out of your part-time line into your full-time line, and basically she would be adding an additional staff social worker to the operation, but the sense is you talked last month that you have.
I have some more stats on there.
Good, that would be great. Go ahead.
So I think I put it in my report. I mean, we're averaging about 147 intakes per month. That's way higher than it was in previous years. For the last 2 months, or the first 2 months of the year, we've had 514 more visits than the last 2 months of last year. So our census has never been this high. It's well over 22, it's over 2,200 people at this point. So we're just seeing the additional need, and it really would be difficult to fill 2 part-time positions versus 1 full-time person to be able to take a full caseload.
And the hope is that, these are billable positions
billable, yes.
and that, the
There's revenue.
investment that we make will have
Correct.
some additional.
Oh, yeah, we'll have revenue definitely that comes in for all those visits that
So leaving the two part-timers unfilled, that interrupts the revenue as well too, but.
Yeah, and I think one full-time person could take a pretty large caseload, but also it will help. Well, the need is higher, but also our caseloads are very high for our other therapists that we have there currently, so.
Heidi?
So historically, it's not, it's been difficult to bring in the part-time social worker, but not when you advertise for a full-time social worker.
Well, I think we're up
That's
against,
hard, too.
I think we'd be up against difficulty filling either. Our part-time positions usually would be someone, when somebody retires and they come back part-time, that's how we've been able to fill those positions historically. But I don't, we don't have anybody in that place that they're retiring and gonna be able to fill that part-time position. So I think it will be easier to fill a full-time person. I think it's definitely easier to advertise for that, I don't know. We did have some interest from when we filled our last position, so I'm hoping if that individual is still interested, we could potentially hire that person that we really liked. So there's potential there. But they were definitely looking for a full-time position.
So with the other two part-time positions, will those be removed from the org chart, from the head count?
Yeah, I mean, there'd be unfunded, the money will be moving into the full-time budget line and will be unfunded from the part-time.
And then you would pretty much never plan on filling those two part-time positions?
I would never plan to film without coming back and asking to fill up if they would ask, yeah. So I'd have to do that anyway.
Right.
Yeah.
That's it. I want to say thank you for being creative, because, that's great management.
Thanks.
Thank you.
Okay, any other questions? All in favor of this? Aye. Okay, great. HH 14th, we're definitely in the money. This is the state opioid money that is now going to be coming through your state aid and being able to be passed through.
Yeah, so you had there's two streams of money coming down. You had the direct payments to the counties, which we've already kind of, given this community services board the ability to make recommendations for that. This is coming directly from the state as part of the opioid advisory board that the state put together, which is there's director of community services that are part of that. They recommended that the money comes to the region based on a formula, and that's how it gets filtered to the county, based on, their formula that have that population need and so forth. And this is going to be money that comes to the LGU, like state aid, but is not state aid.
Okay.
It will be reported differently than our state aid. It will not be on the CFR like all the other state aid is. It'll come to us, and that we haven't decided on a process of how we're going to figure out how to spend that money and spend it in the best way or the most effective way yet. But this is just accepting the money.
And I looked at the resolution. This is for the years 22 and 23. So it's 2 years worth of funding.
Yep, and then it will be coming year after year after year for the
Wow.
next however many years. So I'm working on putting a spreadsheet together to keep all the money organized from the county payments and then these payments that will be coming to the LGU.
Can I,
Yeah.
can I move to bundle, 14, 15, and 21?
I had a quick question. I forgot, how much is it? Which money is it?
This is the over
We haven't- we
500.
haven't moved for
There's
discussion.
a question on the
I
floor.
thought,
Move. I second.
Thank you.
Okay. 521, yeah, that's,
Over $520,000.
okay. You had a motion to kind of group them all together.
Yes, 14, 15, and 21.
And 15 is, I think the easiest way to explain 15 is you're asking to, again, modify your mental health budget that was passed at the beginning of the year, because your budget contained a project director for this opioid money, and it also contained an individual who was doing the outreach for Narcan. That particular position is no longer a county employee. It is now under contract. So this resolution, you're asking to move the $41,000 to get you through the rest of the year, from your 0.1 salary line to your contractual line, so that you'll be able to support these two people using the grant money that you got, 100,000,
And-
million, and the 75.
From the opioid settlement funds that came through the community service support, yes.
So that's really it's asking for a transfer within your 2023 budget. And then 22, authorize 21, excuse me, to accept the regional abatement dollars as a pass-through to the city of Auburn. So I assume there's money earmarked for the city of Auburn, but in order for them to get it, he has to pass through the county mental health.
Correct. That's the money that's coming to the LGU that will be passed through to the city. That's how they're doing it in all the regions.
So if this passes, then you'll be able to pass through that 88,000. We won't have to program for it, nothing. We'll
Nope,
just be a
we're not
pass-through.
responsible for anything, no reporting or anything. The city's responsible for that. It's just a pass through for them to get the funding.
Okay, so we have a motion to bundle 14, 15, and 21. All in favor?
I,
All right, great. Okay,
Um,
you have, you're gonna
Yeah,
start?
I just updated a little bit about the clinic. Obviously, we've been very busy. The need is obviously there. Also, we received notice. We had applied for an evidence-based practice grant. It was $10,000 per therapist who was, so if anybody doesn't know, we have about 17 therapists who are intensively trained in dialectical behavior therapy, which is simplest form. It's for very high-risk people, youth, adults, who are experiencing any emotion dysregulation. There's different components to it, including skills training. So we provide groups, individual counseling, phone coaching, as well as you have to be a part of a consultation team. So we have 2 full consultation teams at Mental Health. This would be funding in order to become certified. So it was $10,000 per therapist. It's $170,000.
Did you get it?
We got it.
Okay.
So I'll be coming back with a resolution to accept the funds, but just a couple things to know about that is there's not many certified therapists in the entire state of New York. And there's even less certified programs. So in order to become a certified DBT program, you have to have at least 1 certified therapist at all times. So our goal is, it's a 2-year grant. The goal is to get as many therapists certified. So there's different things they have to do. They have to do, there's a mindfulness requirement to it. That's a big component of DBT. There is a test. You actually have to go to a testing center and take a test. That would be part of the money would be to pay for that. Offset any time that therapists are putting towards this. You also have to videotape 3 consecutive sessions that show and demonstrate that you're providing the evidence-based treatment correctly. So we've been working with a consultation from the behavioral tech, which is they're the one, Marsha Linehan was the one that created that training institute, and she was the one that created DBT. So we have ongoing consultation to hopefully get all of our therapists up and ready to be able to submit all of those things to be able to become certified. So you don't really see many clinics, and usually they're private practice. So you definitely don't see many community mental health centers that are providing this treatment, let alone to the level that hopefully we're able to provide it. So it's for the most.
Require all your staff to do it?
So we asked ahead of time, we had to apply for everybody that was intending to do that. And
Yes.
everybody, all therapists said they would be very interested in doing that. So our goal is to get as many therapists through that process as we can. Even myself, so I'll be taking on.
And it might
clients.
answer we feel angry. I mean, all of
All
those kids.
those,
Yes.
so it's really, it was that for adults, and then it
All
was.
the kids that said, I'm so
100%.
angry.
It was adapted for adolescents and.
Right.
Yeah, I mean, it's for any problem behavior that you can think of. I guarantee it fits and it works well. And, I know I've talked about my other stuff with the school that we submitted a grant for that. So it's really about prevention and providing these skills in a different way. Because they really are, I use the skills all the time in my own life. So they're very valuable. If anybody's interested to learn more about it, it's really good stuff. So I'd be happy to answer any.
Do you use it on
questions.
us?
All the time.
Yeah.
On everybody. It's
Yeah.
good stuff. It's just like life skills that make sense and help people make better decisions and see things differently. So.
It's great.
So that's pretty remarkable that it would take 1 therapist to submit the paperwork for a certified clinic, and you're looking to certify all of them for.
Yeah, I would, so the hardest part is, working a client through it's a year-long treatment, where there's a lot of requirements and you really have to get their commitment. That's the hardest part, but to be able to provide those 3 sessions in a row is what you need to submit. I think we could definitely get there with, I hope all of us, myself included, so it's kind of my.
Lauren, you're gonna need a full-time just for Elaine, you know that, right?
My emotions are regular.
Everyone can benefit, I swear, so. But yeah, if anybody has any more questions, I'll be happy to answer.
The only other question I have, it's about your report. It's, sort of related to this. You just mentioned that it's a year that DBT is essentially your long process and commitment for the client, consumer. With the numbers that you're averaging, 147 new intakes every month, what is the average length of treatment? Do you have those stats per?
I could look at that.
Individual?
We have people, I can tell you, that have been coming for years, like no more than 10 years, some of them coming for med management at this point only. And then we have people that, just need 6 months of treatment. But our no-show rate, I think, is under 20%, which is pretty good. But I can get those numbers for you.
Yeah.
Yeah. I mean, of course, people come to their first appointment, may not come to the second. But I can look for those numbers for you too.
It's a good question, Heidi. That's
Great question.
Daytime mobile crisis will be starting on Monday. So, we have, I think our goal is we'll be rolling that out to law enforcement first and kind of getting our therapists in the groove of that, and work out any kinks. And then we'll be up and running and be able to open that up to more referrals.
all this time.
I know, I feel like I've been talking about it forever, so I'm really happy to say that. Yes, and then just some Healing Cayuga updates. I know you got the report in front of you, but a couple of things to note. Monica worked with the Department of Social Services and the Cayuga Health Network to write a $2.5 million SAMHSA grant related to homelessness. And that would be over the next 5 years. And this would,
When would the award be? I was wondering about.
I forget when we submitted it when, Chris, do you know?
Not long ago, just a couple.
No, it wasn't very long ago. So
August.
it's usually at least like 6 months usually before you'd even get any of the funding at least. So basically what we're looking to do is we can't build housing overnight. So we're looking to wrap around services with people in emergency housing who are homeless, and provide them with case management, peer services to be able to link them to treatment and or other services that they might need and help them get more permanent housing, as well as any mental health or substance use treatment or referrals to places where they can access those resources. As well as there's some other things in there for, expanding street outreach and doing other things in the community, as well as some positions for the Department of Social Services as well. And then the BJA grant, there's a list of all the different places that the $1 million funding is going to over the course of the next 3 years. So you can see all the different providers and agencies that will be getting money and what the projects entail. So we have Nick's Ride will be providing a peer support at CPS and foster care. So they'll be embedded in DSS, which I think is a really cool thing. They will be providing reintegration support for individuals leaving substance use treatment and or incarceration. They also will be providing peer support at the CAP arraignments for linkage to people with opioid use disorder towards treatment opioid court instead of jail and criminal charges. Chad will be we're doing the clinical assessments and intensive case management for the Auburn Intervention Court. Training costs for 911 dispatchers to facilitate. I talked about the diversion of calls from 911 to divert them from law enforcement and get them to mental health professionals. So we just worked on that. I think 911 will be ready to divert some of those calls starting May 1st. So the goal is to get calls to mobile crisis and or 988 from 911 so that people can get the help that they need when it comes to mental health or substance use crisis. The Mental Health Center's opioid overdose prevention program will expand Narcan distribution to rural areas as well as law enforcement and EMS and first responders. We are looking to create an overdose fatality review board. Yes.
I just wondered what that was.
So that's really where we take case studies, right? It's sort of working backwards, but to look at cases where somebody died of an overdose and be able to collectively, there's a lot of people at the table, there'd be a lot of stakeholders at the table, but what could we have done?
Missed opportunities.
What could we have
Yeah.
done? And it's not really to place blame on anybody, point the finger. It really is to look at it and say, how could we have maybe saved this person's life? And how can we save other people's lives in the future based on this? And then.
Is that happening now with Duckett? I mean, there are some.
Well, the idea is, yes, he was written into the grant as part of that. So I know Monica's had conversations about that, but we haven't started it. We've really been talking to other counties that have started it. So we've gotten some information from them and they really feel like it's very useful time spent to be able to look at that in sort of the opposite direction, but hopefully can make a difference in other people's lives. And then project director facilitates regular grant application meetings with partner agencies. And then we do have an overdose task force. We talk about high-risk cases of people that have overdosed multiple times and how we can link them to resources and treatment as well. And then one last thing that's not on there, for those of you that don't know, I know the link was sent out, I believe, I think Elaine, you sent the PBS link out. So
It's great. It's really-
PBS came here and interviewed staff, our staff, Monica, as well as agencies from Nick's Ride, Wally, and at the jail. We went to the jail as well. So it's a really good piece. If you haven't seen it, it's kind of really neat to be recognized nationally for the work that we're doing here. And I tell you, everyone has done such a great job and we've made a difference. And I think we're still pushing forward to make a difference. But the credit to the staff that does the hard work on the ground. So
I know I'm not a legislator, but can you send that out to everyone? Because I'd love to see it.
I will send it out to everybody.
I gotta tell you, I'm gonna quote Dave Gould when he says that we do have a great county and like, there's certain departments that tug at us differently, like me personally, like your department being one of the, I'm homeless. And just to hear the work you guys are doing, just so proud because I also concerned about your guys' mental health. Like to even come up here and have to deal with that and then, have us critique your budget, the restraints on you and have you still come up here and knowing that you need all the, even if we gave you all the money we could give you, it's not gonna be enough. So I'm really just proud of our county, especially with people like you, Lauren.
Well, I mean, the credit to the staff too. They're the ones that are really doing the hard stuff and they're seeing things every day that aren't easy to see. So, and then another thing is News Channel 9 did go to Kinney's today for the Narcan event and they did a story that will air tonight on the news. So I'm sure it will also be on their website. So I just want to let you guys know that as well.
They went to Kinney's?
Yeah, they had a Narcan event at Kinney's, where they do the free Narcan training and News Channel 9 came today. So to film that. Want to let you know?
Great news. Thank you.
Right.
Thanks.
Thank you.
Great job.
Thank you.
Good job. Okay, Brenda and Debbie, the two are left. Brenda, Brenda has 3 resolutions from Office for the Aging. 2 of them, we can talk about HH 16 and 17, we'll group those together. They are filling an aging service specialist due to a recent resignation, and that would be Mike Case, I believe, just resigned. And then 17 is authorizing to fill a food service helper position, which is also a budgeted vacancy that you have. So if we could get a motion and a second for 16 and 17.
I'll move to bundle those two.
Second.
All right, any questions about those two?
I have a question. You said 17 is a budgeted vacancy, so it's a backfill.
Yes. All in favor?
Aye.
Any opposed? Great. And then, Brenda, you want to talk about using some additional money that you're going to be having kind of timeframe will be out?
We were notified by the state due to the end of the major disaster declaration that some of the COVID-related funding that we received, that we have currently flexibility to use, but as of May 11th, we will not have any flexibility to use. We basically need to use it. And so we needed to look really hard at how we could spend approximately $80,000 to benefit the community and decrease our expenses in the department is covering as long a period as possible. So we decided that it really made sense to replace the lovely first car that we'd had, the 2015 Malibu, thinking that, you know, is going to be reaching the end of its lifespan, number one. And then number two, we're having a significant difficulty maintaining adequate volunteers in the rural areas, and have talked about for some time now, how can we meet the need out there? And what we would like to see happen is that to ensure that our residents out in the rural areas can get a hot meal, have a van that is able to hold a large quantity of our large containers, and ideally be retrofitted at some point to have additional battery power so that we can plug in multiple of those electric containers to keep the meals hot, and they will keep them hot all the way to Summerhill, all the way to Sterling, wherever they need to be. Again, this has been something that's been a concern. We have the money to address it right now. We'll lose it by the 11th. We can't spend it on a vehicle after the 11th.
I get a motion in a second.
I'll move it.
Second.
Any other questions?
Yeah.
Yeah, sure.
So that's one of the criteria. You can't spend it on the 11th. And the second vehicle that you described seems like a specialty vehicle. Where are we going to find something like that, spend it on that by the 11th?
So Shireen has worked with me to do the bid process for the two vehicles. And then we have asked for any type of van, transit van type thing. If we can get one, we can get one. If we can't, we can't, but we're trying. Now that's the goal. And they have a lot of time to work with what could be done. And that was the first thing we wanted to try.
No purchase order would be good enough, that the intent to buy, or?
That's where I'm getting at.
Yeah.
is to get-
Correct. I'm so sorry. Yes. As long as we have a purchase order, we're fine by May 11th.
Oh, okay.
Yes, we have confirmed that with the state.
Okay,
Didn't understand the question.
thank you. I get a lot to explain myself.
Elaine,
I get-
I just want to thank Shireen for working with Brenda. I talked to her today and she's working hard with you to try to get
She
this done.
is.
There's a time frame. What is it, May 6th or
May
something?
11th.
May 11th. So I want to thank Shireen for working with you. on that.
Yeah.
Thank you.
Shireen's actually doing the.
She's the actual
Yeah,
purchasing agent.
Yes,
Until
right.
we find one, and hopefully we're going to have one very soon.
Do we know what kind of vehicles we're looking at, or is it she?
Same, we're good. Another little SUV to replace the Malibu, and then a transit type van for the food is the goal.
It's something they made in Fairhaven. I'm not sure though, Jim.
But I know that we ended up buying instead of not for this purpose, but instead of a small SUV, because of the equipment that our emergency medical car carries, we ended up getting a Tahoe, or because equipment's getting so heavy now.
Yeah.
It's an option, and it's 4-wheel drive. Necessary. All right, thank you, though. That's good if we had something in place before.
Okay. Motion second, all in favor?
Aye.
Any opposed? All right, do you have stuff for us, Brenda?
Yeah, I do have a few things. I'm not gonna take too long here, but I wasn't able to put a report in, and I would just want to say that that's kind of a symptom of what's going on with us in our office right now, because I almost always have a report in of some sort. I really like to share with you what's going on. We're very understaffed. We have 5 vacancies out of 19 staff. 3 of those are in the nutrition program, our site managers. And I think the staff are really struggling, and everybody pitches in, and everybody covers, and everybody does everything they can. But I think it's just appropriate to share with you that it is a very tough time for our staff right now. And we can talk a lot about not adding staff, but we have a bigger problem right now of just having enough staff to do the job. Our funding is about 80% reimbursed. When we don't spend the money, we don't have people, we can't serve the public, and we can't claim the state and federal funds that are sitting there for us to use for the public. So that is my biggest concern right now. And I just wanted to share that on behalf of my staff because they really are going above and beyond. But people can only do that just for so long. We have a lot of moving parts and our meal program in particular, that goes out 5 days a week, all throughout the county. We can't just not do that. And with not having enough staff, it's pulling in all the other staff to get out there and get those meals out there. And, it's just really hard. We have, one of our biggest issues has been, it was almost a year ago, I came to you with the knowledge that we would be losing our fiscal person to retirement in December. I knew that position required some pretty significant training to transfer from the person retiring to a new person. We got, very few applicants. The applicants that we did get, made an offer. They weren't interested. People declined when they heard what they would have to do. So we upgraded the position 5 months ago. Haven't gotten one applicant. I have a county retiree who's come back to help us a couple days a week. A couple days a week doesn't even begin to keep up with what needs to be done with this job. This position handles, under normal circumstances, payable, payroll, HR work, all of our funding. We have almost a $2 million budget. We have 16 at least subcontractors we work with. We have over 15 funding streams. We have multiple claims that have to be submitted every month. We have just incredibly detailed reports that we have to do for the feds in the state. We can't keep up. We're getting the services done, but we can't keep up with everything else under these circumstances. So I just want to give you a heads up.
This is more for Dave, maybe Elaine. I might have dreamed this, but did I just read an email in the last week or so where HR
That was my question.
they're trying all kinds of innovative new
So I
things.
appreciate that contract and I'm hopeful. However, I already interviewed someone where I thought she would be very good at the job. She looked at the description and said, yeah, I don't think so. The other issue for her was that she also was on a list for civil service that she's already approved on an active list in Onondaga County. And rather than be provisional here, chose to take a job in Onondaga County. Understandable. A lot of people are afraid of the, kind of concerned about the civil service system and not being, we talked about that earlier. But,
So even if an individual is identified through this half contract, unless they're staff, I asked Diane, because there wasn't very many questions, that some people, depending on the level, will be employees of half themselves, come in and do the job. We'll have them for a month or so. Some are they're actually trying to recruit on our behalf. They're going to pay in the same hourly rate, take their cut above, and see if they can do kind of case finding or job placement.
Mhm.
But these would be provisional. They would be provisional pending, unless they're on a civil service list anywhere.
right. And this exam hasn't been given yet. So it's going to be a
And
while.
who knows when it would be given, because it's fiscal officer 1 or 2 or something, fiscal officer 1.
We are working with our Civil Service Commission to try to rectify and maybe change some statistics or whatever you want to say, some credits of taking these tests, trying to get more people to do it, because we got to go by what the state says, state civil service. It's the stupidest law I've ever seen in my life. It was made in the 1800s and it hasn't changed since. It ties so many people's hands. You have to take the top 3, you have to be provisional. There's so many different things to the civil service law that was really outdated. I wish I had the power to change it in Albany, but I certainly don't. But it needs to be changed someday to help everybody out.
And so that was the catch for this candidate, was the test.
Well, it sounded like the candidate already is on another list in another
Test,
county.
yeah, previously in another
So-
county.
Obviously, if they got an opening there, they're gonna go because they're already accepted.
Yeah. All I can do is try.
On a happier note,
Doing a great job. Thank you.
pass that on to the staff.
Thanks.
I do want to just thank Elaine and other county folks that participated in the March for Meals. That was a really positive experience, at least for us. I hope it was for you. And I know that the folks who received the meals from our guest delivery folks really enjoyed it and appreciate it. There's some really great pictures on our website, and we appreciate that support from everyone for being able to do that. And we do continue, again, Kim does, our volunteer coordinator does continue to put something in the paper all the time. She's putting things on Facebook all the time. I know she's onboarding a new volunteer coming up soon. It's just an ongoing challenge. And I talked last time, it's just a little different world out there for volunteers right now. So we have to kind of continue to be creative and figure it out as we go, how to best serve the growing. I have to continue to remind it that this population is growing. The population of the county is going down, but the number of seniors, the number of people 60 and over is going up. So we've got our job cut out for us.
Brenda, I just want to thank you and Kim for accommodating my schedule because I couldn't go when everybody else did. So I went just last week during my spring break, and it was really a wonderful experience. I was shocked at how much work goes into that every single day. So really amazing work by everybody there. Kim was fabulous and really nice. It was really a great experience.
Thanks for bringing that up because I thought you were coming in the future, but I should have known it was during this.
That's okay. That's fine. Yeah, it was wonderful that we really had a good time.
Very nice.
No, I don't bring him to people's houses just in case. I'm here.
Any other questions for Brenda?
I had a question.
Go ahead.
I think you got to answer something.
All right, thank you, Brenda.
Thank
Thank you.
Thank you.
Elena, can I just say one more thing about this sort of state law? It was, as I said, in the 1800s, it was meant to do good things because of nepotism and stuff. You had to be the top three. I understand when they did this, they did it for a good reason. But now it's so outdated that everybody's hands are tied with the top three. Just because you can take a test doesn't mean you're the best. So I am convinced, I've already written a letter to the civil service, saying my piece. It certainly won't do any good, but I think other people need to do that too, because this law needs to be changed. Just wanted to get that out there.
Okay, Deb, sorry. Last but not least.
And then Cleveland.
I only have one resolution, so that's probably alphabetical.
Bad order. You want to go over your resolution?
Okay, I have one resolution authorizing the chair of the legislature to enter into a contract agreement with ABC Cayuga, otherwise known as Play Space, using ARPA funds to fund $10,000 towards their outdoor play area. A little bit of history behind that. They do have the indoor space, which is on North Street. I had a meeting a few weeks ago with Elaine Myers, who's on their board, and Nancy Tehan. I got a tour, was informed they're doing the outdoor area. They had all but $20,000 secured. So I thought I would ask for 10. They're asking the Jim and Julie Boeheim Foundation for the other 10, and they'll have everything funded and hopefully be able to open this summer.
Out of the 120
Out of the
they needed.
120,000 that they needed for this, and $50,000 of the 120 did come from the city of Auburn using ARPA funds as well.
I'll move it.
Second.
Question. Is this available to the public?
Yep, it's available to the public. I know also Cayuga County does subsidize a lot of admissions for people who aren't able to pay. And so it's going to be an indoor and outdoor space for people to utilize, especially now since COVID is over and people are more comfortable, or if people aren't comfortable, they still have the outdoor area they can go to if they don't want to be inside around a lot of people.
It's really well utilized, this space.
It's a great space.
Yes.
Can I ask a
Yes,
question?
sure.
Is this a not-for-profit or what is this?
Yeah, but Play Space, they're a not-for-profit. They're located, they're right on Route 34 across from Genesee Garden Apartments. They used to be in the old Marine Street.
Yeah, that doesn't mean anything to me.
You drive by.
I just want to know if it's a not, it says ABC Cayuga Inc.
You know where Holy Family is, Jim?
And no, is it a not?
It is not. It is not.
Okay, so it's a 501c3.
Yep.
Okay.
Sorry.
I don't care where it
I don't
is.
care what color it is. It's the old Blockbuster.
We actually had one of the meetings there.
Just one question, he got 4 addresses.
I know.
And we did, it was last spring, we had our.
Yeah, we
was
did.
it fall? We did.
Yeah.
You were
The
there,
health services meeting.
right? Any, everyone in support of using $10,000 to support the play space?
Aye.
Aye.
Great. And just a couple of updates, I'll be quick. The applications did come in for the OCFS funding for the Youth Bureau. The good news is we had a lot more applicants than we've had in the past, but the bad news is that we don't have as much money to fund all of the asks. I did speak with Elaine briefly prior to the meeting, so we can possibly use some ARPA funding for some of those asks. But just to kind of give you a perspective, we have through the New York State OCFS funding, we have approximately $72,000 to allocate, and I have $270,000 worth of asks from community organizations. So our first board meeting with our youth advisory board, we'll have our first meeting on April 27th to do a brief orientation and go over a lot of these proposals and start to make some decisions on funding, since a lot of the requests are for summer programs specifically.
Ask a question about that.
Yes.
So is the application time cut off for that?
Yep, it was it. It was June, March 24th.
Okay, so the discussions that we had that for the MEC program up in district.
Yep, they had the application in.
They
already.
did have the application in, okay.
The amount of the money that's allocated towards recreation,
Mhm.
what are you doing? What is happening with those funds?
The 20,000, so we have about $52,000 worth of general youth programming, and 20,000 of that is the youth sports. The two organizations that applied for that specifically is the YMCA and Booker T. Washington. Booker T. Washington received it last year for an intramural program that they do, and the YMCA is applying for it for various things. They have a kids' health program they want to do, and they're also looking to receive funding for this summer because they're looking to do free swim lessons at Casey Park to go along with the City of Auburn summer recreation program if that does get up and running again.
I'll ask for Lydia. Did you get applications from outside the city?
Yes, I did. I have applications from Moravia. So the applications I received are from Chad, the Booker T, YMCA, Chad, Cayuga Counseling, the Garvis Center, Salvation Army to fund camper sponsorships for a camp they have in Penn Yan on Seneca Lake. The Rev Theater, Perform for Purpose, the Auburn Music Boosters, the MIC program, and the Moravia Summer Recreation Program in Play Space.
That's a great turnout for.
Yeah,
you know,
I was getting worried. I think a lot of people wait till the end and then all
Right.
of a sudden, just like that last week, just kind of got a lot of them.
When I think, you know, looking at this historically, there was just sort of it's almost like an assumed pass through. And now it looks like we're generating some creativity and interest from around, and hopefully that will grow.
Yeah, and some people weren't aware of the Youth Bureau or they weren't sure what we did. I had a great meeting yesterday with Kelly King. We met the president of the college who wanted to know a little bit more about what we did. So we had a great brainstorming session about some things we can do as well.
And we got 2 great legislators on the board.
Sure do. A couple other things that weren't on here. I just want to give you a brief update. I did speak with Wally yesterday regarding the LJ Safe. He has had 150 visits since March 6th, so he's doing well. He hasn't done a lot of marketing yet, but they've done movie nights, a potluck dinner, game nights, walks, and he has filed for his 501c3 status as well. And one more quick thing, I just found out on Tuesday at a meeting with the New York State Youth Bureau, there's a board, kind of like an association, New York State Youth Bureau members. We have a opening on the New York State Governor's Youth Council. So there's 62 youth members that are part of this council that meet once a month virtually, and Cayuga County has 1 opening. So each county in the state has an opening. There's 3-year terms typically, but I found out Cayuga County does have an opening. So I can send the information out. Anyone from 13 to 21 can apply to be on this youth council to represent New York State.
Right? So you will be talking about that at your first board meeting? I would think.
Yeah, and I've been starting to send out like to some of the schools and some contacts. I just started sending out the links to get on the actual application portal, but I can share that with all of you as well if you know of any youth who might be interested in applying.
Do we
for
have any
this.
representation now?
We don't know.
Okay, so this one seat is, it's
Yep,
open and the only.
Yep,
one
we don't have one. I just was made aware of that this is a thing the other day when we had this meeting. So I'd love to get Cayuga County.
And other counties do have representatives?
Yeah, some people are looking for them as well. A lot of times, if somebody goes on maybe at 18, 19 years old, they do age out once they graduate college. They're looking for a job and they don't really have the time or the commitment any longer.
Elaine?
Elaine behind you.
So when you said you're reaching out to schools up in District 1, both the old District 1 and soon to be District 1, some of the students that live in Cayuga County go to Wayne County, Oswego County schools and stuff. So I'd ask that if you can search that out. I know for Fairhaven and part of Victory, the kids go to Red Creek, which is in Wayne County. Some are Sterling, they go to Hannibal, which is in Oswego County. So the literature might have to be more specific, is that they have to be a resident.
Resident, okay, perfect.
Cayuga
Yeah, I
County.
appreciate you bringing that up.
They might never get to see that opportunity,
And they wouldn't.
Yeah, that's a good point.
so.
Good job. Thank you.
How often are you gonna have your board meetings, do you think?
We're supposed to have them a minimum of quarterly, but I think because it's a new board and just getting started, we have to approve bylaws and do a lot of different things as far as orientations and getting everybody kind of participate and learn about what we're doing, kind of set a vision. So I anticipate it might be a little more initially to get started.
Brenda, will that be open to anybody, any of the legislators that would like to attend?
Yep. It's going to be on April 27th in caucus room 2 at 5 p.m.
Great. Great job.
All right.
Thank you.
Thank you, Brenda.
I'll make a motion to adjourn.
Okay.
You don't want to do that for discussion.
But it's nice out.
Thank you. Okay.